So one of the last things I want to talk about are, so it's a pretty important topic. It's things that orthodontics can't fix. And I really want to go over these because sometimes when we wait until our children are 12, when all of the permanent teeth have come in, and we're expecting braces to fix all the problems, sometimes there's some things where it's just too late in order for braces to fix them. Or it requires very invasive surgery or something that's very drastic in order to fix the problems, which most people aren't willing to do. So let's go over one of these things that orthodontics can't fix. And we mentioned a tongue thrust and how incorrect tongue position can cause an open bite because the tongue isn't at the roof of the mouth where it should be. And I want to go over something else that it can cause. So since it's not on the roof of the mouth, this can cause a narrow arch, and I think I've explained that before. But a narrow arch can also be a taller arch. That's just how the jaw develops. And a taller arch means that you can have a gummy smile, where a lot of your gums, just like in this picture, is shown when you smile. And a lot of my patients don't like it that have it. And so this is something where if you have it, you wait until you're 12 in order to try and fix it. It's something that orthodontics can't fix. They have a hard time fixing it. Usually it requires surgery, like we talked before, something very invasive. And so most of my patients that have this, they never fix it because it's too hard. But if we start training the tongue earlier before the jaws are finished developing, then the whole issue of a gummy smile could possibly be avoided altogether. And so I really want you to know that information so that you don't wait until it's too late. Okay, the other thing that braces can't do is it can't widen the lower jaw. Now it can widen the upper jaw, and it's with something called a palatal expander. And we've got a picture of it over here where it goes on the top teeth. And I don't know if many of you parents help your kids with this or if you've had it yourself. It's the thing where you have the key and you turn it, and over time it widens it a little bit each day, and then over time it can widen the upper jaw. Now this is an option for the upper jaw, but the lower jaw doesn't have anything like that. And so if you wait until you're 12 and there's expansion that's needed, it can't come from widening the lower jaw. And so orthodontists then are kind of stuck. If they really need to create space, they really only have one of two options to do. They can either, one, extract teeth, and so these are usually the premolars that get taken out, and those are the teeth behind the canines, and this was a very common thing about 20 years ago, but it's becoming less and less common as time goes on, but it still happens. I've had some cases where I needed to take out teeth. And sometimes that's your only option if you need to create that much space. If it's not as much space that you need to create, then sometimes they can get away with what's called interproximal reduction. And that's where they take and shave a little bit of the enamel in between the teeth, usually in the front teeth. And this is a way of creating space as well. Now, like I said, I've placed brackets and wires for about 5 years now, and I had some cases where I needed to extract some bicuspids. But now that I know about Healthy Start, how much better is it to start earlier so that there isn't a possibility of extracting the teeth later? Now, in addition, there's something else that I want you to consider about this, and I have no study to back this up, but it just makes sense to me. If you extract 4 teeth in the mouth, then you have just made the mouth smaller. By making the mouth smaller, then the soft tissues like the tongue are effectively made bigger. Now, when we lay down to go to sleep, let's say we are laying on our back, then the soft tissues relax and start hanging back in the mouth. But since our mouth is smaller, then these soft tissues have a better chance of causing either a partial blockage, which is snoring, or causing a complete blockage, which is sleep apnea. And that can happen throughout the night. And so by extracting teeth or even by interproximal reduction by making the mouth smaller, then you may have just made it harder to get a good night's sleep. And so Healthy Start can eliminate all of that. It can help expand the lower jaw, because the way that the lower jaw expands is by the teeth erupting properly. So those lower front teeth, as they are erupting properly and coming in correct position, they're kind of pushing off each other, and that's what expands the jaw. And that's one huge benefit of Healthy Start, is that with the appliance in, when those permanent teeth are starting to come in at about age 6, then they're going to be coming in where they're supposed to be, and so you get that expansion of the jaw. And so these are a couple things that I wanted to talk about, just to make sure that you knew that once you turn age 12 and start the process of braces, there may be some compromises at that point and some things that can't fix. But I feel like Healthy Start, that's one big advantage, is that since you're starting earlier, you're tackling these problems up front.